you all are doing awesomely well. Let us continue with our clinical oriented series for Neetpg and INI-CET. So your Neetpg dates have been postponed and it is the golden time when you should be more oriented towards clinics and the correlated parts. Let us see what is there in this very important question for you. A 25-year-old man presents with 1-year history of draining right ear with greenish discharge along with a pad or odor. He has been complaining last week of increasing headache with fever, and on examination the temperature was found to be raised along with inflamed eardrum with greenish discharge through a perforation, and some amount of photophobia was being complained by the patient. There was no meningeal signs that was observed. Subsequently, a CT scan of mastoid and brain was done with contrast, and the CT scan has been provided to you in the question. So here we can see an axial cut of a CT scan showing you bilateral mastoid bones, and here you can see or note some lesion or ring lesion which is there on the right side of the temporal lobe of the brain. MRI was also done, which also shows you a hyperintense lesion. Now coming to the question, what is the diagnosis and what are the most common intracranial location for this kind of lesion? So first of all, seeing the CT scan and the peculiar history, you have to diagnose the thing. So it is a case of complication of unsafe variety of chronic otitis media, which is otogenic brain abscess. Now if you ask me what is the most common location, then it is the temporal lobe. So most common site for otogenic abscess is the temporal lobe followed by cerebellum. In the scans, you can see the opacified mastoid antrum, and in the second brain window scan, you can see a rim enhancing lesion in the temporal lobe, which was confirmed by MRI, right? So if there is any suspicious of this type of lesion, we should do both a CT scan and an MRI. Coming to at what point should lumbar puncture be performed, if at all? So the answer to it is usually the lumbar puncture is not indicated and should not be performed until it is ruled out with a CT scan. So if there is suspicious of possible intracranial pressure increase, the lumbar puncture might cause reverse or damage by causing herniation. So lumbar puncture in this condition can lead to coning of the brain and prolapse of it inferiorly under pressure. So the management differs in these cases, and if the brain abscess is suspected, you should actually start with, means if we ask about the treatment, there is as such no universally accepted treatment, but if there is progressive deterioration due to increased intracranial pressure, the final treatment is drainage like any other abscess. So it can be done via craniotomy or CT guided aspiration. Another route is doing mastoidectomy and transmastoid drainage. So many authors recommend, or you will see many starting with the conservative management, and finally if the patient doesn't improve, you have to do the mastoid surgery, mastoidectomy, radical, and drain the mastoid abscess via the ear. So mostly it is a combined effort by the neurosurgery and the ENT team, but if you are confident enough, you can do both the things at the same setting, that is mastoidectomy along with drainage of the mastoid abscess or the otogenic cerebellar brain abscess. So one case of similar kind, I have posted the video in the YouTube, you can also find it from there. Now another question which was there is, what kind of CT should be ordered if there is suspicious of brain abscess? So coming to it, if you are suspecting a brain abscess, which is a soft tissue lesion, only a bone window CT scan is not sufficient. You have to use brain soft tissue windows along with the contrast, and ideally a MRI should also be done. So for CT scan, you should look to the brain soft tissue windows along with contrast, and a MRI should also be prescribed. So this was an interesting case of a complication of chronic otitis media, where we discussed about otogenic brain abscess, which are more common in the temporal lobe. A CT plus MRI will guide you the location and planning the management for the otogenic brain abscess. The ideal treatment is mastoidectomy along with drainage of the abscess, and followed by the antibiotic, broad spectrum antibiotic treatment. So this was a beautiful case. Some more interesting case will be followed in the coming videos, so stay with me and keep hustling and studying till you get your desired seat and the rank. This is Dr. Shivaam. Stay happy and stay healthy.